Imagine lighting a cigarette and taking that first inhale. Within seconds, more than 5,000 chemicals surge into your body. Tar begins coating your teeth and gums, eroding enamel and setting the stage for decay. In your nose, delicate nerve endings dull, stealing your sense of smell. Inside your airways, smoke paralyzes tiny hair-like cilia, cleaners of your respiratory system, leaving your lungs vulnerable to infection, chronic bronchitis, and emphysema. The smoke fills the alveoli, the tiny sacs where oxygen normally flows into your blood. But instead of oxygen, carbon monoxide slips across the membrane, clinging to hemoglobin and blocking your body's oxygen supply. That's why smokers often feel breathless. Their cells are literally starving for air. At the same time, nicotine races to the brain in just 10 seconds. It floods your reward circuits with dopamine and endorphins, creating that brief buzz that hooks the brain into addiction. But the cost is steep. Nicotine tightens blood vessels and damages their inner lining, restricting circulation. Over time, blood vessels stiffen, platelets get stickier, and the risk of clots, strokes, and heart attacks climbs. Meanwhile, the chemical cocktail in cigarettes attacks DNA itself. Carcinogens like arsenic and nickel trigger mutations and block the body's natural repair systems. 1 in 3 cancer deaths in the United States is linked to smoking, not just lung cancer, but cancers of the throat, bladder, pancreas, and more. Smoking also weakens bones, damages vision, reduces fertility in women, and causes erectile dysfunction in men. But here's the good news. The moment you quit, your body begins to heal. Within 20 minutes, your heart rate and blood pressure start returning to normal. After 12 hours, carbon monoxide levels drop, allowing oxygen to circulate freely again. 1 day later, the risk of heart attack begins to decline. In just 2 days, damaged nerve endings recover, and your sense of taste and smell start to sharpen. After a month, your lungs work better. You cough less, breathe easier, and feel more energetic. By 9 months, cilia in your lungs are restored, and your defenses against infection improve. After 1 year, your risk of heart disease is cut in half. 5 years in, the chance of stroke continues to fall. After 10 years, your risk of dying from lung cancer drops by 50%. And after 15 years, your risk of heart disease is essentially the same as someone who never smoked. Quitting isn't easy. Withdrawal can bring irritability, anxiety, and depression. But these effects are temporary, and powerful tools exist to help nicotine replacement therapies like gum, patches, and sprays, support groups and counseling, cognitive behavioral therapy, even regular exercise. All of these make it easier to leave cigarettes behind. In the end, every cigarette avoided is a step toward repairing the body. Your heart grows stronger, your lungs cleaner, your DNA more resilient. Quitting smoking doesn't just add years to your life, adds life to your years.